Hello everyone, welcome to Easy Nurse, where nursing education made easy. In this session, we will discuss a new unit, that is Unit 14, First Aid. So let's move on to the topic. Introduction. First aid management. What does mean by first aid? So first and aid. First means you have to give the first care. Aid means to help. So first aid management is nothing but to giving the care or help to a person who are injured. Why? To save the life of that person. Okay. So first aid management is a care given to the sick and injured person. Next point. First aid is a first and quick help which is given to any individual experiencing either a minor or major disease or injury. Why? To protect the life, prevent the condition from the deteriorating. What does mean by first aid? First aid is the first help to whom we are giving, to the injured person. Why we are giving? To save the life of that person. Or if the person is suffering from any disease or any injury. Suppose you take an example, the first person is suddenly got accident. Okay, we are giving the first aid management. Why? So that the person we can save the life of that person. Okay, so first aid is nothing but to give the fast and quick response to the injured person so that we can save the life of that injured person. Okay, so first aid is an arrangement of initial, quick and on the spot treatment to casualty of a major or minor elements. On the spot means what? On the spot, if the person is had a road traffic accident, so on the spot only we give the first aid so that we can save the life of that person. Okay, it is performed by an unskilled individual to harm individual until medical persons or help arrives. So unskilled individual means what? Because the normal person who are walking in that road, okay, so suddenly they saw some accidents happen, so they are not skilled person. Okay, so they doesn't know how to protect the life of that person, but they are giving the first aid so that they can save the life of that person. Okay, and when up to the medical person or help arrives, they give the care to the injured person. Okay, so certain disease or minor wounds may not need further clinical considerations apart from first aid medications. Okay, I hope you understood about the first aid management means what. First aid management is nothing but to give the quick and initial and on the spot treatment so that we can save the life of the injured person. That is meant by first aid. So next, move on to the definition. So first aid is what does mean by first aid? It is the initial, quick and temporary care which is given to a victim of accident, injured or sick person until medical professional arrive. Okay, so we take an example of suppose the person got a motorbike accident, okay, or suddenly road traffic accident. So we are calling the ambulance. So until the ambulance arrive, we giving the first aid management so that we can save the life of the person. Suppose any bleeding is there, so we are trying to stop the bleeding by applying some cloths on that, okay, or by providing some pressure on that area. So why? To prevent the life of the person until the medical professional or that ambulance arrive. That is called the first aid management. It is initial, quick and on the spot treatment that may be performed by any unskilled individual or skilled individual, those who know how to give the first aid or those who doesn't know how to give the first aid. Everyone can do the first aid management, the initial management to save the life of an injured person until the medical professional arrives. That is meant by first aid. So next definition, according to the American College of Emergency Physician, that a first aid manual or first aid is the initial assistance or treatment which is given to a person who is injured or suddenly become ill. I hope you understood about what does mean by first aid. So let's move on to the next topic, that is basic principles. So before giving the first aid, you should know the basic principles. Okay, safe response in the crisis or situation for well-being of the victim. Next is minimize the further injuries to the victim by fixing or stable the situations. Okay, use suitable techniques or first aid procedure. Next is move the victim carefully to reduce the pain to stable the condition. Reassurance. Next is reassurance and instruct the victim. So reassurance is nothing but to giving the psychological support to the victim. Those are the basic principles you have to follow for first aid management. Next is Next, move on to the next topic, that is aims of first aid management. What are the aims for the first aid management? Okay, there are the 5 P's we have to keep in your mind. There are the 5 P's. First one is life preservations. Okay, you have to protect the life of an injured person. For that, we are giving the first aid management. Next is protect the victim. Pain relief. If the person is suffering from pain after getting accident or maybe fall down from the height, so they get pain. Okay, they get pain. So to reduce that pain, we are giving the treatment. Okay, prevention or control on worsening the condition of the patient. So the condition maybe get worse. So before that, we have to give or we have to prevent the conditions. Okay, and provide psychological support and reassure. So we have to give the psychological support to the individual person. Okay, then reassure. Reassurance means what? You have to give. You have to reassure the patient. Then everything will be okay. Okay, so those are the aims of the first aid management. We have to keep in. We have to keep in our mind. Okay, so first one is life preservation, protection of the victim, pain relief, then preventions or control, and provide psychological support and reassurance. Those are the aims. Okay, I hope you all understand. Next, move on to the next topic, that is golden rules of first aid. First one is adopt a systematic approach. Next one, avoid the risks for yourself as well as patients. Assess for the danger signs at scene. Scene means what? The scene where the accidents happen. Okay, so be quick and clear up the chaoses if any. Chaos is nothing but the crowd. Okay, you have to clean that. Then comfortable position. So if the patient have a breathing difficulties after getting the accidents, okay, you have to give the comfortable position so that they can breathing difficulty can solve. Okay. Then call for help. You have to call the ambulance or you have to take other persons. Those are present in that situation. You have to take help from them. Okay. Then prioritize the situation. Next one, provide first aid and stabilize the patient. Seek the help of bystander if needed. Bystander is nothing but the person who is present in that incidents or situation. You can take help from them. Okay, that is called by bystanders. Then next is follow. So those are the golden rules you have to follow for the first aid management. Next one, scopes of first aid. What are the scope? The scope of first aid, they have a 3 main components. The first one is diagnosis, treatment, then disposal. Those are the scope of first aid management. Next, move on to the next topic, that is remember, safe. So safe you have to remember when you are giving the first aid management. Okay, first one is S for stop. Stop means what? Carefully, when you have to stop and you have to carefully see the situation and act accordingly. Okay, so you have to see the situation whether they need your help or not. If they need means you have to give or you have to act accordingly. Okay, that is means by stop and see the situation. Okay, then A. Next is A. A means what? Assess. Assess means what? You have to see the situation, you have to assess the situation and how to handle them. If the patient have it suddenly fall down from in front of your eyes, okay, they fall down from the height. So in that situation, you have to see the person whether they need the help or not. Then you have to assess whether how to handle that situation. You have to assess that. Then find. Find means you have to call for help or provide the first aid. First, you have to call for help. Like if you need any help from other person, you have to call them. Okay, and simultaneously you have to give the first aid management. Okay. Next is E, exposure of protection. Follow the universal protection precautions. Okay, that's what you have to keep in mind when you are seeing some person who are injured. Okay, and to protect the life of that person. Safe. Next, move on to the next topic, that is first aid kit. So first aid kit is available in everywhere, like homes or any school, colleges, hospital, buses, everywhere, or factories, everywhere. First aid kit is available. Why? To protect the life of the injured person, or we can give the emergency situation. We can use the first aid kit to save the life of the person. Okay, so it is a providing very important tools to providing emergency care to the victim. Is available in the home, school, occupational places, buses, cars, factories, to keep ready for any kind of emergency situation. So in first aid kit, what are the items you have to keep? Okay, first one is dressing, cotton roll. Next is dressing pad, then triangular bandages, roller bandage of different sizes, then pair of tweezers, then branch of safety pins, different scissors, adhesive tape, tongue depressor, splint, thermometer, max paw, then Macintosh, clean sheet, kidney tray, torch, small notepad or pencil, soap, earway, rubber catheter, tunicate, petroleum jelly, tube, any antiseptic solutions, baking soda, salt, potassium permanganate, milk of magnesia, then medicine dropper, then solutions such as Dettol, Savlon, Spirit, boric acid, hydrogen peroxide, BP apparatus, stethoscope, glucose or sugar. Or sugar cane you have to keep in that first aid kit. Okay, so I hope you understood what are the items you have to keep in the first aid kit. Okay, everything which is important in that emergency situation, like an BP apparatus, sugar glucose monitoring strips or that machine, then thermometer, tunicate, bandages, different kind of bandages or roller bandages, adhesive tape, antiseptic solution, then adhesive tape. So everything which is important to protect the life of the person, we have to keep in first aid kit. Okay, some medicines also we can keep in the first aid kit. So I hope you all understand this session. With this, we have come to the end of this session. Next session, we will discuss new topic. Till then, keep learning and keep exploring with easy nurse.